Good morning everyone from Altra Genesi Anunnaki team. I am Irene and today I've been translating for you a post written from Tiziana, another member of our team. The topic we address today received a lot of attention on our Facebook group and is about the biblical prophet Elisha. So the title is Elisha's Story, a miracle or a clinical case. The case was analyzed by our neurosurgeon, Dr. Arturo Berardi, who has carefully examined the Bible from a medical scientific point of view, in order to verify if it was possible to find within it any trace of specific knowledge or skills that could link to the Elohim. This is why he began a meticulous analysis of the so-called miracles present in the Old Testament, always using the translations from Greek and Hebrew provided by Mauro Biglino, so as to remain as faithful as possible to the texts. The episode that we will analyze is narrated in the second book of the Kings, in chapter 4, from verse 19 to 37. This episode, we will comment, is classified as a miracle from believers, and it would be really striking if that was actually the case, because we are talking about the description of an alleged resurrection of a child performed by the prophet Elisha. Now, let's try to have a greater respect for what that the Bible is, and let's try to believe in the good faith of the author and pretend that they have told us an event as it has been lived by them or as it was told to them. But now, let's proceed with order. Elisha was the chief disciple of Elijah and took over his position when Elijah was taken away by the Elohim in their chariot, driven by horses of fire. A very famous episode described in the Bible, and that probably deserves another post, for it has so many connections with other episodes of abduction that we can find in other ancient texts. But it is important to emphasize that the two prophets had a very close relationship with these Elohim that came from above, and therefore certainly possessed a far superior knowledge compared to those of their contemporaries, as this can help us understanding the case we're going to analyze. So, back to Elisha. The Bible introduces this story by telling the story of a boy who goes to the fields early in the morning with his father, and there he feels sick. The illness occurred early in the morning when the sun is not high in the sky. Therefore, it can hardly be a case of insolation. The thing that immediately jumps to the eyes of a neurosurgeon like Dr. Berardi is the anamnesis of the child patient. If we read the biblical passage carefully, the child, before falling to the ground, complains of a severe pain in the head, and then, brought home to his mother, stands on her knees until noon, and only afterwards, we are told, he dies. The mother places the child's body on a bed called Elisha's bed and leaves the body there to go and look for the prophet. Here, it is important to remember that previously the story has focused on the special way in which the child's mother, who was sterile, managed to get pregnant, thanks to the intervention of Prophet Elisha. Therefore, the bed of Elisha could be a bed that today we would simply call operating table, and that was in their house because it was already used for the interventions Elisha practiced on the mother. Otherwise, it is to ask why the author needs to specify the ownership of the bed if it was just a normal bed. A consultation on the text led several neurosurgeons who collaborated with Dr. Berardi to formulate an unanimous diagnosis. The one described from now on is the treatment of a cerebral aneurysm or cerebral arteriovenous malformation, also called AVM. In both cases, the patient experiences an intense headache due to the leakage of blood that goes to irritate the meninges, causing precisely sudden and acute pain. After a variable period of time, the appearance of superiorous but also comatose state can take place until the deeper coma is reached. In fact, we are told that the child stayed on his mother's knees until noon, then he died. Probably, as suggested by Dr. Berardi, it must have been a picture of deep coma, in which the patient is no longer awakened unless he is suddenly treated. In fact, it is what appears to occur, because the mother, as said in the Bible, went up to spread it on the bed of the man of God, closed the door, and went out. At this point, the story maintains its medical scientific value. The woman warns her husband that she intends to leave in search of Elisha. She meets him and tells him what happened. Elisha, as even nowadays a primary doctor would do, sent out his assistant forward, with the task of carrying out the necessary first aid operations before the surgical intervention. The fact that Elisha requires the disciple not to greet anyone and not to respond to the greeting of anyone on the street is very important, because it denotes the urgency of the situation. Then, a couple of questions arise spontaneously. To what extent all this haste if the child was dead? Why was it important not to lose precious time? What could change if a delay of few minutes is carried out to greet a lifeless body? Elisha then gives a precise order, and you will put my stick on the body's face. Translation from the Hebrew from Mauro Biglino. It is understood that from this point on, the biblical author makes a kind of summary, probably not having the necessary preparation to describe the situation with a wealth of details. Pretending that what we read is true, it is clear that the assistant is urgently sent by Elisha to put a sort of ventricular catheter to reduce the intracranial pressure, as still today is done in the case of aneurysma or hemorrhagic flooding of the ventricular chambers in the case of AVM. Today is placed in frontal position where the intervention is then performed. In fact, immediately afterwards, we read that the assistant places Elisha's stick on the child's face. Then, he introduces the ventricular catheter without getting any awakening, as reported later to Elisha when he arrives on the spot. The procedure followed by Elisha technically recalls the process of intubation of the patient with a laryngoscope, and then the induction of anesthesia. Moreover, he is described to us as he would lay on the child, probably to warm up his body and to avoid hypothermia. Fortunately, once the child has been intubated, he returns to normal breathing. Recall that, in the case of ventricular flooding, as Dr. Berardi is telling us, there can be a respiratory block due to crushing of the pontis or bulbospinal area, in which are the breath centers. At this point, Elisha intervenes, probably surgically, but the observer obviously cannot describe what was happening, or over the centuries, the entire operation has been cut or modified because it wasn't understandable. But this is just a hypothesis. In verse 35, a summary of what happens during the operation and in the next operative moments appears when the anesthesia is finished. The surgeon removes the tracheal intubation cannula and then wakes up the child, as the text says. He went back, bending over him. The boy coughed 7 times. Then he opened his eyes. Dr. Berardi tells us that these are the classic shots of cough that are observed after the extubation phase, when the patient in the awakening phase becomes intolerant to the tube in his throat that reaches up to the trachea. Now, this is a possible key to read the episode. We propose you as we have been proposed by a team of neurosurgeons accustomed to such situations, which have carefully examined the episode as early anamnesis and following operations. It is up to you now to decide if you prefer this version or to continue believing in the version of a miraculous intervention with the stick of Elisha, which represents, as proposed by New Biblical Commentary, an extension of his miraculous powers. Thank you very much for your attentions and have a nice day from Altra Genesi team. Goodbye.